I think stigma is a social construct. We cannot just change it overnight. We've only been measuring it for the last couple of years, maybe a decade or so, maybe a bit longer, but at least systematically. And measuring is only part of that. And then we still need to take action and make that change, and changing people's attitudes and changing norms in society. It takes time. So I think we need to be patient, but we also need to keep fighting and systematically fighting, not just here and there.
I just want to encourage communities of people living with HIV to ensure that they really think more progressively around an advocacy plan in terms of the data that they collect when they implement the stigma index, and to ensure that advocacy plan really seeks out to bring the issues out and address the challenges that people living with HIV will be facing within their communities, because data needs to speak through advocacy.
Poses a dilemma for those of us who have been working on HIV for many years. How are we to think about the coronavirus pandemic? What lessons should we draw? What lessons can we apply? And how do we make sure that ongoing health needs continue to be served?
Осознать, что в действительности психическое здоровье и ВИЧ – это не разные сферы. Психическое здоровье и ВИЧ так или иначе объединяются в одном человеке, и для того, чтобы оказывать наиболее качественную помощь и поддержку, нам необходимо рассматривать человека целостно.
Секс-работники сказали, что подобные показы для них более доступны и понятны, чем напечатанный текст, который не все читают, а смотрят видео интереснее. Очень понравилось всем, что именно сотрудники нашей организации сыграли роли как актеров.
It's time, because it has come out and it has shown that we need community-led and community-based interventions. It's time for us, and it's time for donors to invest in that, because this is not the first time we are talking about this. I want to also highlight that we started talking about fast track back in 2016, leaving no one behind back in 2016. It's now 2020, we are still talking about leaving no one behind. Have we done anything? Have we brought people on board, or we are still leaving them behind more?
No era posible realizar incidencia política a favor de los derechos de las mujeres y garantizar la visibilización y la inclusión de sus necesidades en las políticas públicas, en las legislaciones y todo, si no estaba esto conectado con un trabajo directo en las comunidades y con una escucha activa de las diversas realidades que viven las mujeres con VIH en los países y en las comunidades de América Latina.